Welcome back. Thank you so much for staying with Monday Special. Remember to use the hashtag Monday Special KE on Twitter or text us on 22422. Remember to leave your name and location. Tonight we're discussing adolescents living with HIV/AIDS, and we'll speak to two of them as well as two experts as well, just to tell us more about the fight against HIV/AIDS in the country right now and what you can do as well to support. Let's introduce you to the panel right now. We'll start on my right. We have Eric Gitau. Eric is an adolescent specialist with UNICEF, who will be giving us, who also has a background in counseling, so he'll be telling us a little bit more about that. And then next to him we have Mercy Kilonzo, who is a lovely young lady. She's 16 years old. She's living with HIV. She's an advocate as well. She's spoken out against it before, and she'll be telling us more information about how it is living with HIV and what she's been able to do to lend her voice in the country. And then we also have Elijah Lemayan. Elijah isn't new to the show. He was here previously when we interviewed a group of students from the National Children's Government. He is also living with HIV. He's a young advocate as well. Started speaking about it when he was 10 years old, and he'll tell us more about how he feels about it and what he would like to see the country, how he would like to see the country address the issue of adolescents living with HIV. And finally, we have Florence Anam. She is an advocacy officer at NEFAC. She'll tell us more about what her organization does a little later on. Thank you all so much for joining us. I think before we hear from Elijah and Mercy, I can probably start by asking you, Florence, a little bit about the numbers. How many teenagers in Kenya, how many adolescents, I should say, are living with HIV?
I think before we start with Kenya, I probably would like to inform you and the viewers that the issue of adolescents and HIV has become something that is quite of a problem. Not a problem per se, but a discovery. The last UNAIDS report showed that amongst the population of adolescents aged 10 to 19, we were experiencing more deaths related to HIV and AIDS. And that is not something that we're seeing amongst other targeted populations. Okay. So the women, the men, the other people, you could see a reduction in the deaths, but for the adolescents,
you didn't see
the numbers were going high.
Before you go to the numbers, what would you attribute that to?
I think, and which is normal, we like to use this analogy for when you're flying somewhere, they keep telling you, when the plane is going down, pick up your mask or something, and before you put it on your child, put it on yourself. And I think that is the format that we use to address HIV. We focused on the adults, and we focused on addressing the adults, and it was the women, and yes, people were dying at the time, and so of course we were focused on the adults. But we forgot the young people that were born with HIV at the time, who have now matured into adolescents, and who have special needs that are different from the needs of the adults that were found, HIV positive 10 or so years back.
All right, now the numbers
so we have about around 200,000 young people living with HIV. We are looking at ages between 10 and 24. Okay. And they have various needs. Be it treatment, be it transition from pediatric care to adult care in terms of treatment, be it their sexual and reproductive health rights. So all those things not being addressed by the different structures, be it health, be it education, be it the society, be it their parents, because some of these kids don't even know their HIV status, don't even know why they need to be taking their medication. Okay. So some of all of these things
but it's starting to be addressed. Before we move again, another quick question. What regions would you say are most affected, if I can ask it that way?
According to the Kenya HIV estimates, the regions most affected with HIV is Nairobi, leading, and then we have Homa Bay as the second. Okay. So the problem again has been, and that's where the president is also asking for the data, is who are these children and where are they? And not necessarily in terms of identifying them as an individual, but what are the numbers we are talking about, and where exactly are they within the counties. Okay,
and we'll come back to that in just a moment. Eric, a quick question again before I move to Mercy and Elijah. I'll read this. It says, young women between the ages of 15 and 24 are 4 times as likely to be infected with HIV as young men in the same age category. Adolescent girls are at a clear disadvantage. Who or what would you attribute this to? First of all, is that accurate?
That's very accurate. Okay. They're 4 times more likely to get infected than boys. They're boys their peers. That's usually attributable to a number of things. One, just the first is that the cultural practices that are very harmful, FGM, early marriage.
Also, they're more exposed.
Exactly.
Yeah.
You know, also the fact that in Kenya we do take our girls, we do take our boys to school at the expense of taking our girls to school in some societies. So such exposure to different issues like that would make the girls get a lot more exposed.
Okay.
Also, in the Kenyan context, a lot more girls are exposed to issues like what's this? A lot more girls, sorry, are exposed to issues like rape, and that, of course, immediately just exposes them
makes them vulnerable to that.
A lot more and
All
faster.
right. Let's now talk to Mercy and Elijah. Mercy, you're now 16 years old. How old were you when you began to understand that you are living with HIV?
Yeah, it was like 6 years old.
Oh, when you were 6?
Yeah.
And what is it that made you realize or begin to ask about it?
My aunt usually take me to hospital, and one day it came into my mind, why is she always taking me to hospital and yet I'm not sick? So when I was in my bedroom, I took the bottle. I read the notification there. Then I found ARVs, what are they for? Then I went and asked her, what's the meaning of these? And why am I taking them? So she came and told me that I'm HIV positive, and the doctor said that I must drink them so that I may live healthy.
Okay. Did you understand it at that age? You were 6 years old. Did you really understand what that meant, or did you begin to understand that as you got older?
I began to understand that when
you got older.
Yeah.
And when you realized what it meant, how did it make you feel?
First, I was shocked, since I knew I was healthy and I was not sick. Secondly, to make me fast to lose my friends, since I knew they'll start discriminating me, which will lead to lost self-esteem.
Yeah. Did you lose any friends?
No, they were friendly to me.
Okay.
That's make me.
It made you happy.
Yeah.
Okay, you were born with HIV, right?
Yes.
From your baby. All right, I'll come back to you and about what you've been able to do with your message in just a bit, but I want to ask the same question to Elijah. How old were you when you began to understand that you're living with HIV?
I was 6 years old when I began to understand that I was living with HIV. So the reason why I started knowing it, I started seeing books scattered on the floor. And then I took the books and I started reading on the pictures. I saw a boy lying down and some green bags and soldiers. And then I went and asked my mother, Mom, what are these soldiers? And then she explained to me that it's the CD4, the immunity.
Okay.
And then I went and asked my mom again, Mom, why are these green bags eating the soldiers of this boy? And then she explained to me that is the HIV virus.
Okay.
Yeah. And then she explained to me that I have the virus, and guess what? I just hugged her, and then I told her God knows. God has a plan of why.
Of why.
Yeah.
Okay, and your mother has also been very active in terms of speaking about HIV. When did you begin to start talking about living with HIV as an adolescent? You're now 12. When did you begin to speak about it?
I began when I was 10 years old. I started when I was in interviews. They came to our homes, and at first I was fearing, but then I came to get used to it. Yeah.
Okay. All right. Very powerful. And for the two of you, how do you think the Kenyan society is treating adolescents living with HIV? Let me start with you, Mercy. How do you feel that the society treats girls like you living with HIV? Is society fair?
Yeah, I can think that. In society, some, starting with the at hospitals, schools, and even the community.
Yeah.
There is high discrimination.
Also, there is discrimination.
Yeah.
And you faced it before.
Yeah.
You faced discrimination. Do you feel the same way, that there's stigma attached to it? Yeah.
There is very, very high discrimination in hospitals and in schools. Like I can tell you this short story. When I was in class, the teacher was teaching. He was teaching about HIV, that HIV and AIDS kills. Now they were telling us death messages, and already we have the HIV virus. Sometimes I could lift my hand up so high, so to remind the teacher that I'm in that very same class. So I was feeling so left out when they are not balancing the syllabus. So I'd like that stigma to stop.
Okay.
Yeah.
And I think that's why we're here tonight, to demystify it and really do with the stigma. For the two of you as experts in the field, how rampant is it, and what are some of the gains, if at all, that have been made to try and address stigma, especially against adolescents living with HIV? Can start with
in schools particularly. Every time we work together with NEFAC, and we conduct a number of discussions with adolescents, and they will always tell you that the place where they face the highest level of stigma is in schools, from teachers and peers, also within their own family members and the immediate community. So it's really high. In some cases in Kenya, in some places in Kenya, it's higher than others. Interestingly, in Homa Bay and Kisumu, it's not as high as it is in the coastal area, as it is in Nairobi also. So I think just because maybe of the high burden, and I mean, if the burden of the lake region is almost 20-something%, that means 1 in every 5 person. I think a lot of people have gotten used to that.
So is there a tolerance, perhaps? There is.
Exactly.
All right.
Yeah.
I know after the break we'll come and talk a little bit more about, psychologically and families, etc., dealing with it. Before we take that break, though, Florence, can you add something to that, and maybe what you're trying to do?
I think I will agree with what he says. There is high stigma, especially in schools. I think the education sector is not has not created frameworks for addressing HIV in schools. For young people, and especially that's one of the key reasons why we are losing adolescents. It's lack of adherence to treatment. Most of the adolescents, especially older adolescents, Mercy is in Form 2. I was hanging out with a lot of her peers today, and many of them admit to going periods of time minus their medication, and they will give you various reasons for why, and most of it is happening in schools, and especially boarding schools, which are largely the schools that are high schools. Most people have day schools for primary, but boarding, most of the boarding schools are high schools are boarding schools. So there are no frameworks for addressing how they can be able to go and get this medication without profiling them, without making them stand out, so that their peers are not talking about them. So they stop taking the medication.
They struggle with that. Very quickly before the break. So Mercy, you're saying that sometimes as teens, as adolescents living with HIV, you don't take your medication because of the fear of stigma. Is that what happens?
Yeah.
Okay, just not wanting to be seen to be taking the medication.
Yeah.
And that's harmful, of course, because then, you're not getting better. Have you ever been in that position, or for you, was it always important to take your medication?
Mine was very important to take my medication because I knew the challenges I will face when I lose the medication.
Okay.
But can I just chime in?
Yes.
Interestingly, for just a minute, we were talking to about 7 of them, and they said, we know the information, we are given the information in school, we know we are supposed to take the medication, but we will not take it because we are fearing what our colleagues will say in school. So that's
all right. We have to take a short break. When we come back, like I said, we'll talk about dealing with it. I'll also ask Mercy and Elijah who their biggest support systems have been, and perhaps even government intervention, and your thoughts on that. Remember to use the hashtag Monday Special KE on Twitter. Text us on 22422. We'll be back after this break. Welcome back. Thank you so much for staying with Monday Special, where we're talking about adolescents living with HIV. And Eric, now I want to delve into more of the psychosocial support and your thoughts on someone discovers that their adolescent or maybe their teen's friend is living with HIV. Your thoughts from a counseling perspective on how to then deal with that, and how to move forward with that kind of information?
I think today we're fortunate to have both Mercy and Elijah, whose parents have been the immediate support.
Okay.
And that's very, very powerful. The fact that both of them are saying that they have not, and like some that Florence was mentioning, they have not skipped on their medication, they are fully adhering, is because at home they have supportive mothers and a very nice supportive system. So maybe a call to parents whose kids are living with HIV. It's not, as he says, it's not a death sentence. I mean, he mentions that very powerfully, because if we instill stigma from the homestead, immediately that child will not be who they're supposed to be. It is also important to look at a child not from the lens of just HIV. Look at an adolescent not just from the lens of the disease, but the potential that the infinite possibilities that they have for their future, and begin exposing them to the many things that they still would be exposed regardless of what it is. I mean, look at it from the lens of maybe just any other condition. And if someone is, if you have a child who has measles, will you not take them to school? Will you not educate them? Will you not expose them to things that will build on their talents? And so it's very, very important. There are also support groups, and again, both of them are in support groups, and the network of persons living with HIV and AIDS has a huge network of support.
I know
groups.
I wanted to tell me about that later. We do need to move along, and again, before I go back to Mercy and Elijah, some quick questions here. Do you think that the introduction of sex education in the curriculum has registered any gains so far?
I think when we discuss around comprehensive sexuality education, it is much more broader than sex education. It's about giving a child life skills. It's about talking to a child and giving them appropriate information for their age, so that they're able to understand their sexuality and deal with their sexual reproductive health issues.
And you don't think that's been...
I don't think it's getting enough support as it should, but it's because we focus more on hearing the sex education part, but we forget the comprehensiveness of it. It's about, I mean, what are we looking at, Janet? About 60% of violence against children is meted by someone a child knows. So it's a child's probably parent, it's a child's relative, it's someone a child knows, it's the shopkeeper next door. But we do not have mechanisms to empower such small children to be able to come and tell us, I feel like somebody touched me inappropriately or did something wrong.
In fact, a little later, I definitely want to hear from Mercy and Elijah their thoughts on how they can be more empowered. Another imperative question here is that the reproductive health care bill that was rejected in Parliament last year sought to have the introduction of condoms and other contraceptives in schools. Would this, in your opinion, have helped tame the scourge, so to speak?
Again, I think it depends on how you look at it. I don't think that introducing condoms or contraceptives as a standalone solution, as a sexual reproductive, to address sexual reproductive needs of adolescents is enough. I think for me, when you're dealing with adolescents, especially post 12 years going up, you need to be able to give that adolescent the correct information that they need. I mean, we need to come off this, burying our heads in the sand and discussing some things and deciding they are bad, and we're having a discussion and they're telling us, we are told to abstain. What is abstinence? And they're 12, 13, 14. And then so how do we make this about not only abstinence, but this is the decision you have to make, but these are the responsibilities that come with it.
All right. And that now brings me to you, Mercy. Obviously, as a young lady living with HIV, what are your thoughts in terms of how you feel you can be empowered, or your peers as well, can be empowered to learn about living with HIV or learn about their options? Florence just said, for instance, a lot of you are told abstain. Do you understand what abstinence is? Maybe you do. Do you understand what it means?
According to me,
yes.
I can't understand it well.
Okay.
Because just when we say abstain, and the syllabus also says abstain, they are not going to the point direct. Because I know to abstain is to just stop from sex. But according to us, we are living with AIDS, and you know, it's not healthy to have sex while having sex because of many other STDs and STIs.
Yeah.
So how can that abstain come through?
Yeah. So do you feel like a lot of people your age don't understand, or that they're not being given accurate information?
They've not been given accurate information.
Yeah. And do you think it would make a huge difference if they really got that information?
Yeah.
You do?
Yeah.
Do you feel the same way, Elijah? Do you feel like young people are not getting accurate or enough information about living with HIV?
Explain much further.
For example, do you feel like perhaps when you're being talked to about HIV, that parents or grown-ups are not very clear? Okay, English gets harder as I get older, clearly. I need to, yeah. Do you feel like the information needs to be clearer to you, for you to better understand?
I think I already understand it much better. So it's okay according to my parents. They are teaching me nicely.
Okay.
Yeah.
For you. When you look at children your age, do you know children your age living with HIV right now?
Yeah.
What do they say to you? What are their fears? What is it that they're scared of? What is it that they're afraid to say? The challenges? Yeah. What are some of the challenges that they say they have?
That, like, others are told to stay out of the class while others are inside. And when it comes to exam, the ones who are the negative are the ones who passed, and the positive ones are the ones who are kept outside. They did not pass, and this is not very good, because we should be treated equally as children of God, right? Yeah.
Okay. Yeah, that's true. That's powerful. Very powerful speaker. That's amazing. Yeah, you wanted to add something?
Well,
You're still in awe.
I'm still in awe, but yes, I'd like to add that part of the holistic and comprehensive information that also needs to be passed to kids, first, the fact that it's not a death sentence, the fact that knowing your status is important even for the ones who are in their teenage age and probably engaging in sexual activity, and it could be risky sexual activity. So it's important for them to know that there are options like going for a HIV test and encourage HIV test from an early age. As soon as someone has made their sexual debut, they should probably be provided for the option for HIV testing and counseling, and then thereafter issues about treatment, about adherence, about sitting in, about ensuring that the medication, they take it fully until, you know, as Elijah also mentioned someday, that his medicine is his best friend. You know, they take the medicine as a best friend and they continue with this.
Okay, we're quickly running out of time. Tell us a little bit more about NAFAC and your core mandate, and perhaps how people can support what it is that you're trying to do.
NAFAC is the National Empowerment Network of people living with HIV in Kenya. We bring together groups of people living with HIV from all over the world. The country. We have presence in the 47 counties with leadership. We try to align ourselves within the government structures and are therefore working closely with the Ministry of Health and relevant ministries to be able to address HIV. Our core mandate basically is to ensure that people living with HIV are involved at all levels of decision making and programming in HIV. We have this slogan where we say nothing for us against us. So nothing for us without us. Okay. So NAFAC exists to make sure that whatever decision being made, people living with HIV are at the table. So for example, the reason why we have young Elijah and Mercy is we are trying to mold them to be able to sit within decision making platforms that are talking about issues for adolescents. We have young people that we mentor, older people, we have women, we have men who are able to then have discussions that are relevant for them to ensure that programming addresses the needs of people living with HIV.
Okay, and then tell us about the All In campaign before we wind up.
The All In campaign is a global campaign that seeks to end adolescent AIDS, period. It seeks to galvanize all stakeholders to come together, from governments to bilateral partners to stakeholders who are, NGOs who are doing to the networks of this world, to adolescents themselves to be on the table. So it's to the media, to civil society, and everyone else to just come together. For the longest time, because adolescents have been left behind, now All In is bringing together all players to ensure that adolescents are no longer left behind, and to ensure that they access treatment and care, to ensure that stigma is reduced, to ensure that adolescents are on the table, making the HIV response a part of their business.
And there's a hashtag for it, right?
The hashtag is End
Adolescent AIDS. So people can follow that hashtag to see the discussion.
Constantly.
I just wanted to say that with support from UNICEF, our initiative, the NEFAC initiative to empower adolescents living with HIV to be able to be involved in and to engage in decision making, is called Sauti Sikika. The name was chosen by the young people, adolescents and young people themselves, and it just signifies that they want their voice to be heard now. And they're on Facebook and social media and Twitter, so anybody who would like to join the space and learn from these young empowered kids can join.
They should join very quickly, because I need to also hear from the children.
Thank you to you particularly, and to Citizen for always ensuring that you create a space for adolescents, for teenagers. While you host many shows, you focus especially on teenagers, and that's something very commendable. So we sincerely thank you and your media house for ensuring that
it's important.
Child rights are constantly pushed forward.
All right, thank you for that. Mercy, what would you like to say to someone your age who's watching this show, who's living with HIV, but he or she is struggling and is feeling sad and depressed about it? What would you want to say to that person today?
I would like to say it's nice to get closer to your doctor, just to your parents, and even to take the medication. Because when you don't take the medication, that the challenge is, and the more you are getting sick, the more you are getting ill.
Yeah, so you need to take your medication. What do you want to be when you grow up, by the way?
In fact, I'm an artist.
You're an artist, drawing. So that's what you want to do.
Yeah, I like dancing. I like music.
Okay, so you're an all-round artist. So maybe one day we'll see you on a stage somewhere dancing. Okay. Thank you so much, Mercy. What about you, Elijah? What would you want to say to your peers who are living with HIV?
I would want to tell them to never stop taking the ARVs, because the ARVs is very important to us. Because when you don't take it, the HIV is going to spread, and when it eats one of the CD4s, they are going to multiply, and they eat and they multiply. So if you take the ARVs and you take it on time, it's going to go and tie the HIVs, and then they push them up to they squeeze them and lock them down there, and then they give the CD4s the immunity, the space to grow and protect your body from the diseases. Yeah.
Do you see yourself being an HIV advocate for the rest of your life?
Yeah.
You do?
Yeah.
Because you sound very passionate about it. What do you want to be when you grow up?
I'd want to be an artist and an architect and a reverend and a scientist.
Come on.
Can you choose one? I don't know if you can do all that. Which is the one that stands out the most for you?
I can.
You can?
Yes,
because
you can.
My future, we are dreaming for our future, and our dreams can come true. So it can be like a reverend. I can do that on Sundays.
Sure.
Artist, like and when I be an architect, I'm going to organize a house the way it's going to be, and then an artist, I'm going like to paint the house or draw some pictures and sell.
Beautiful.
And the scientist, you see, yeah.
What does a scientist do?
Okay, I'm going to discover things. I like discovering things and inventing stuff.
Okay. Wow.
Yeah.
Yes, you can.
Year 12. I was not like this. Thank you. Thank you all so much.
Thank you,
and
Jenny.
Mercy and Elijah, I commend you. You're both very brave, We support you and we wish you all the best. Please continue to lend your voice for other adolescents so that many others can speak. Florence and Eric, the work you're doing is fantastic. Thank you so much for joining us. We'll take a look at some of your feedback as Hussein Mohammed joins me on set in just a moment. Okay, on Twitter, at Angel_Pompey says about 60% of youth with HIV do not know they're infected and so don't receive treatment, putting them at risk. Okay, once you change teenagers' attitude to avoid premarital sex, then their behavior will also conform. Okay.
At Maverick Nyambu, contraceptives and condoms may help reduce HIV infection, but education on abstinence is the best prevention.
Okay, at Cantona Orions, the adolescents need a more sober approach curriculum to breach existing gaps in schools, which I think we touched on briefly.
At Mutua FK, there's need for teenage-friendly messaging to tame stigma and promote acceptance in society.
Okay, at Kate Best K says, we need to introduce an HIV/AIDS subject in primary and secondary schools. Young people are very vulnerable.
And at Arnold_Nakola, the only way to stop stigmatization and discrimination is through education on HIV. Monday Special KE.
Okay, I think finally we have one more tweet before we can take a look at our texts. Teachers and parents should join hands if they want to win the war against HIV and AIDS from their teenagers.
Right, on 22422, Jacinta Malia from Machakos, a peer educator, says, Mercy and Elijah, you're my heroes today. I wish you could come to Machakos one day and meet with my peers. Currently, I'm reaching young girls and married adolescents. She actually leaves her number as well, so I'll share that with you.
Okay.
Pastor Nyabuto Marube Kenerela says, Mercy and Elijah are true champions in addressing the stigma associated with living HIV among adolescents. Thumbs up. And Bernard from Finlay's Kericho says, is there any plan to have every primary and secondary with a school, that is, with a professional counselor? This could help the teens deal with their psychological needs.
Yeah, very powerful. One or two more. King from Busia says, those are two very brave and courageous teens. Everything should be done to all in a similar situation. David Saver from Nairobi says, I fail to understand stigma. People who take ARVs are doing the right thing. And then I think we also have Ken from Eldoret who says, thank you, citizen. I want to salute you for their courage. I want to salute the two for their courage to share their story and experiences with us. Right.
Right.
Thank you. Did you know what you wanted to be when you were 12? Do you still know what you want to be?
Oh, Janet, really?
It's good to be back.
Yes, I knew what I wanted to be.
Okay.
And in fact, I thought it was, okay, let me not go that direction, but yes, he can be all that he wants to be.
Okay, yes,
right?
I agree.
Okay.
All right.
And I want you to read one more message before we leave, because you say I form these things in messages. So I'll just read this message.
Which one?
This one.
Really? Hi, Janet. We can now relax that you're back. We want to hear where you've been because we don't trust what Hussein has been telling us. What have you been telling people?
That she was sick.
Oh, thank you. Well, thank you for watching Monday Special.
Are you going to tell them where you've been?
I've been unwell, but I'm good now.
Right. Okay.
Thank you all to our lovely panelists as well. I'm Janet Mbogwa. Have a good night.
Good night, I'm Hussein Mohammed.
Fertilizer ni ya Falcon aina ya DAP na CAN kwa mazao bora. Mazao bora, mazao ya Falcon.
On Tuesday, the 31st of March, watch the commissioning of the expanded new Kericho brewery that will increase production of their lager brands. This event will be live from Naivasha starting at 10 a.m. only on Citizen TV.
Africa